This demonstration is intended as a resource for previous students and licensed clinicians who can perform dry needling in their practice act and jurisdiction. Please do not attempt dry needling without proper licensure and training. For the SI joint treatment protocol, some precautions to consider are the superior gluteal nerve artery and vein, the inferior gluteal nerve artery and vein, and the sciatic nerve. For this particular treatment setup, you'll insert 6 needles. The first needle will be into the gluteus medius, anywhere from a 60 to a 125 millimeter needle. You'll insert 1 needle into the gluteus medius. Into the gluteus minimus, you'll insert 1 needle, anywhere from 60 to 125 millimeters. Into the gluteus maximus, you'll also insert 1 needle, anywhere from 60 to 90 millimeters in length. At the lateral sacral border, you'll insert 2 needles, anywhere from 40 to 75 millimeters in length. And then in the piriformis, you'll insert 1 needle, anywhere from 60 to 90 millimeters in length.
We're going to identify the iliac crest first, so I'm going to mark the top of our iliac crest. And then we're going to mark our trochanter. So we'll do that with passive hip internal external rotation. So you can feel, and if I put my fingers, pretty much needs to be, it's not going to be above her butt crack, so it's definitely going to be at or below her butt crack as a starting place for the top of greater trochanter. And then I feel the top of trochanter there. And then I want to get to the superior medial point of the trochanter, which is there. So I'm going to mark just a little half moon there. Now piriformis is going to go from the superior medial aspect of our greater trochanter. It's going to fan over to the medial aspect of the ilium from S2 to S4. So I'm going to cheat and kind of look at where butt crack starts. And that can be roughly S4. Then a couple fingers above S4 will give me S2. And then from there, it's going to fan over to the superior medial aspect of the trochanter. So I'm going to get my piriformis there. Glute min is going to be above her trochanter, so I can get glute min right here. Glute med is going to be beneath her iliac crest, so anything below her iliac crest is going to be glute med. And then glute max is everywhere, but I'm going to get one more glute max above piriformis, so I'm going to get glute max right there in the middle.
Like always, you'll maintain a clean technique by using gloves and performing an alcohol wipe down.
All right, so piriformis, I'm going to find that superior medial aspect of the trochanter, and then we'll come off of that. A little tap with a 60, send that guy in. Ooh, that's money. Nice twitch. Glute min, very similar. We're going to get above her trochanter, bracket that tissue, a little tap. Get max. Then lastly, we got med.
And then for gluteus maximus at the lateral sacral border, we'll actually palpate the medial aspect of the ilium, and then the sacrum will obviously be underneath that. We'll hook our fingers around the medial aspect of the ilium, and then you can make 2 marks. We'll maintain a clean technique. We'll use gloves. We'll continue to use alcohol. And now with your fingers hooked around the medial aspect of the ilium, you can insert your needle at a 45-degree angle towards the medial aspect of the ilium, which will be inserting the needle at the medial aspect of the gluteus maximus, which is at the lateral aspect of the sacral border. You may have noticed that she jumped a pretty good bit when I inserted that needle. We probably hit a cutaneous nerve or a small vessel. Sometimes those are impossible to avoid. To set up electrical stimulation, we'll attach our first channel to the 2 needles at the lateral sacral border. Our next channel will be our middle gluteus maximus needle with our piriformis, and our last channel will be gluteus minimus with gluteus medius. For this particular treatment setup, we typically run the electrical stimulation for 10 to 15 minutes at a continuous wave frequency with the intensity set to the patient's tolerance.